Time now for another COVID-19 information segment with Fox 10 News investigative reporter Brendan Kirby. Brendan, we had some pretty exciting news yesterday about an antiviral drug that's shown a lot of promise in treating the novel coronavirus. Tell us more about that, please.
Byron, the drug is called Remdesivir, and its maker, Gilead Sciences, said yesterday that it would soon start human trials of an inhalable version of the drug. Until now, the only way to deliver this drug has been intravenously. That means that only hospitalized patients have been able to get the drug. In Mobile, 3 hospitals have been using it since early May. The inhalable version will be easier to administer and could help patients before they become extremely sick. It works using a nebulizer, which asthma patients often use. It shoots a mist into the airway. Theoretically, patients could be treated at any urgent care clinic. Healthy volunteers will be screened this week to serve as a control group for the study, and COVID-19 patients likely will follow in August.
And there's more exciting news as well from the medical front, but now on the economic front. We know all this has caused a lot of financial pain for a lot of people, but one study suggesting it's not as bad as so many expected. Tell us about that.
Well, that's correct, Byron. The study was published over the weekend by Columbia University's Center on Poverty and Social Policy. Researchers say that the CARES Act saved millions of Americans from falling into poverty. That law, you'll recall, included the stimulus payments and the expanded unemployment benefits. But it had a host of other provisions designed to keep money flowing freely at a time when so many businesses had closed down because of the pandemic. Here are the major findings. Without the CARES Act, unemployment would have shot up to 19.7% and poverty rates would have skyrocketed to 16.3%, up from 12.5% before the crisis. Assuming 70% of eligible families actually get the stimulus and 60% get expanded jobless benefits, the forecast predicts poverty rising only to 12.7%, so just up a little. Assuming higher levels of participation, 90% getting the stimulus money and 80% getting the expanded unemployment, the researchers forecast that poverty will actually decline compared to pre-pandemic levels, going down to 11.3%. The paper forecasts that the CARES Act will result in lower poverty rates for all demographic groups, with the biggest percentage point difference being for Hispanics. The center forecasts a 20% poverty rate for Hispanics with the CARES Act and 27% without.
Wow, Brendan, thanks very much. Brendan Kirby will be back with us for Fox 10 News at 9 with more information about coronavirus. But if you have a question for Brendan, you can email it to him directly at brendan.kirby@fox10tv.com. He's going to try and get to every question that he can get to.